right. Thank you for joining us this morning. I'm Dr. Kara Christ, the Director of the Arizona Department of Health Services. Arizona State University has been an invaluable partner throughout the COVID-19 pandemic, first with testing and then with vaccination sites. That commitment continues today with the launch of this indoor mass vaccination site at Desert Financial Arena. We're continuing a highly successful operation that started February 1st at ASU's Phoenix Municipal Stadium. Nearly 200,000 doses of vaccine were administered at that convenient location, and we look forward to even more here. With warmer temperatures upon us, we have to look indoors for the comfort and safety of our patients and the staff and volunteers. So today, with ASU's help, we are opening the Valley's first indoor walk-through facility in the network of the state-run mass vaccination sites. Moving a large and complex operation from Phoenix Muni to this site was no small undertaking, and DEMA's assistance was critical to making this happen. We thank and appreciate their partnership. With me today is Dr. Morgan Olson, ASU's Executive Vice President, Treasurer, and CFO. Dr. Olson, thank you for all that ASU has done to make this site possible and for everything ASU continues to do to help during the pandemic. We appreciate your support and partnership. And also joining me is Maria Cristina Fuentes, Director of the Governor's Office of Youth, Faith, and Family. With reaching diverse groups being a key part of our vaccination outreach, we're fortunate to have Maria join us once again to deliver remarks in Spanish. Over the weekend, we celebrated Arizona administering its 4th million dose of COVID-19 vaccine. As of today, more than 2.5 million Arizonans have received at least one dose of vaccine. That's roughly half of our adult population. And approximately 1.7 million have been fully vaccinated against COVID-19. Even amid this positive news, we are reaching a turning point when it comes to COVID-19 vaccination. And what comes next depends on each of us. There are signs that vaccine supply is beginning to approach demand. Where appointments at state vaccination sites could be taken within minutes to hours, it's now taking longer for all appointments to be booked, but they do continue to be booked. Along with our county partners, the state is working to continue the momentum. A PSA launching today has community leaders sharing the word that COVID-19 vaccines are safe, highly effective, and the way back to normal life. ADHS is expanding a highly targeted messaging campaign in our underserved communities. In Maricopa County, pop-up clinics are taking vaccine into the community, closer to where people live, work, and receive medical care. But we can't do this alone. We need each of you who has been vaccinated to be an advocate. If you have been vaccinated, you know that the vaccines are safe. You know that they're effective, and you know that they're available to all. So please help us spread the word. While we continue moving towards the herd immunity needed to protect all Arizonans from COVID-19, please continue doing all that you can to reduce the spread. Wearing a mask and staying physically distanced when you're around people who aren't part of your household, staying home if you're sick, and washing your hands frequently. You can learn more about prevention of COVID-19 at azdhs.gov/COVID-19. We aren't out of the woods yet, but vaccines are the path to getting where we want to be. So thanks to ASU and our other partners, Desert Financial Arena will be part of making that happen. Now I'll invite Dr. Olson to the podium.
Thank you, Dr. Christ, and welcome to Desert Financial Arena at Arizona State University. We at the university are really pleased to be able to partner with the Arizona Department of Health Services and with DEMA. This is such an important initiative, as Dr. Christ laid out, that we're thrilled to do our part to help the community succeed. Just as we did working at the stadium in Glendale, and as we have in Yuma, and as we have in Mesa, we plan to make the site here, the indoor site on the Tempe campus, a success. Our charter requires us at Arizona State University to take responsibility for the health and the success of our community, and we see this as one way that we can do that. We all know that the sooner we can reach herd immunity, that the faster that we can ensure everyone's health and success and that the economy will continue to succeed in the way that we all need it to do. So we're really pleased to be able to share the work of our researchers and our scientists and our logistics experts that help make this site work in order to make mass vaccination something that we can all soon look back and say, remember when, and remember what everyone did to make it successful. So we're just pleased to be here this morning. We're now moving to a busy campus environment, a little bit different than some of the other sites. We have a fully functioning university, one of the largest universities in the country, a global research institution, and so we're really focused on making sure it's easy for people to move around. They know where to go, they know where to park, and we can take care of them. We're looking forward to having a full arena here shortly, for Sun Devil basketball games. But in the meantime, we think this makes a tremendous place, to operate a vaccination site. We know that here in the Valley of the Sun in the summer it can get pretty warm. So we're happy to make this available to the community and to the state to make that all a success. And so we're excited about that. We'd also like to thank Desert Financial Credit Union, who has agreed to be our partner, volunteer management specifically. We know reliance on volunteers is critically important. And so, we urge all of you out there who may be listening, if you have time to volunteer to help make this a success, we would welcome you and we encourage you. So welcome. It's wonderful to have you here. And I'd like to share the podium now with Maria Cristina Fuentes from the Governor's Office. So Maria, please.
Thank you, Dr. Olson. Y muy buenos días. Gracias por acompañarnos hoy esta mañana. Mi nombre es María Cristina Fuentes. Soy la directora de la Oficina del Gobernador para Juventud, Fe y Familia. La Universidad Estatal de Arizona, ASU, ha sido un aliado invaluable durante la pandemia del COVID-19. Primero con las pruebas y luego con los centros de vacunación. Ese compromiso continúa hoy con el lanzamiento de este centro de vacunación en Desert Financial Arena. Este centro va a continuar las operaciones que comenzaron el 1 de febrero en el estado municipal de Phoenix. En ese centro se administraron más de 200,000 dosis de vacuna y esperamos que en este centro vamos a repartir aún más. Con la llegada de las temperaturas ya más altas, es muy importante hacer esta transición a centros internos para la salud y la seguridad de los pacientes, el personal y los voluntarios. Así que hoy, con la ayuda de ASU, estamos abriendo este centro al interior para añadirlo a la red de centros estatales de vacunación masiva. Este fin de semana celebramos 4 millones de dosis de vacuna COVID. Ya tenemos más de 2.5 millones de arizonenses que han recibido una dosis y más de 1.7 millones que están totalmente vacunados. Incluso, en medio de estas noticias positivas, estamos llegando a un punto de inflexión en términos de la vacunación contra el COVID-19. Junto con los centros de vacunación pública a nivel de los condados, el Estado está trabajando para continuar el impulso de la distribución de estas vacunas. Un anuncio de servicio público se ha lanzado esta semana, incluyendo a líderes comunitarios que están asegurando que esta vacuna es segura, es eficaz y es el mejor camino para la vida normal. El Departamento de Salud Estatal está ampliando la campaña de mensajes altamente dirigida a las comunidades subatendidas. En el condado de Maricopa hay muchísimos esfuerzos para llegar a las comunidades que más necesitan la vacuna. Pero no podemos hacer esto solos. Necesitamos que cada uno de ustedes que han sido vacunados sean líderes también en este esfuerzo. Si ha sido vacunado, sabe que son seguras, sabe que son eficaces, saben que están disponibles para todos. Así que ayúdenos a correr la voz. Mientras seguimos avanzando hacia la inmunidad necesaria para proteger a todos los arizonenses, por favor, sigan haciendo todo lo posible para mitigar la propagación de este virus. Usen sus máscaras, mantengan distancia, quédense en casa si se sienten enfermos y lávense las manos con frecuencia. Para más información de la prevención del COVID, pueden visitar la página del Internet del Departamento de Salud Estatal. Gracias.
Thank you. And now we're happy to answer your questions. Please make sure that you do use the talkback mic so that people at home can hear you.
I just want to ask you, what are the biggest pushbacks you're getting from those who haven't been vaccinated at this point? What are they saying to the state? What are they saying to the providers that are getting back to you on why they're not getting the vaccine? And how do you overcome that?
So that is a great question. So there's a lot of different reasons that we're hearing for some of the vaccine hesitancy. Some people believe that the vaccine just came too fast. They want to see what happens, to other people who have gotten the vaccine to ensure that it's safe. And then some of the barriers to, previously it was that they were unable to get an appointment. Now we do have appointments available. What we would recommend is when we did our community listening sessions, people said that they would trust their healthcare provider or people that they knew that had already gotten the vaccine. So please, if you've gotten the vaccine, tell people about your experience. We know that the vaccines are safe. What was actually sped up was the production of the vaccine. The drug manufacturers took a gamble and started producing mass amounts of the vaccine before they knew that it would be approved or be usable. So they really took a gamble. That's why we were able to get this out. But the same clinical trials, the same safety protocols were in place and followed as with all other vaccines.
How much pushback are you getting from folks who say, I've already gotten the coronavirus, I was fine, I'm not going to get the vaccine, I survived it already, I probably already have some antibodies. We don't know how long that lasts, clearly, but are you hearing that? And how do you combat, a large segment of our population who feels that way?
So we do hear that people who feel that they've already gotten COVID-19 may feel that they've already got antibodies and that they don't need to get vaccine. Our recommendation is that even if you've gotten COVID-19 previously, we would still recommend that you get vaccinated. We don't know how long naturally acquired antibodies last. We know that people can become infected again with COVID-19. It's much safer to get the vaccine and to acquire your antibodies from the vaccine than it is from an infection. Because, some people have had surprising, bad outcomes, and in those you wouldn't even expect it. So it's safer to get your immunization.
As demand kind of stalls a little bit, how do we make sure that we're not wasting doses? How do we make sure that the doses that we have, which will begin to pile up if demand does fall, how do we guarantee that we're not wasting doses? How do we guarantee that overnight appointments that are generating no-shows because I happen to go to my provider and they offered me the shot, but I didn't feel like canceling, or whatever you might hear. How do you make sure that those doses are not wasted?
So at our mass vaccination sites, we track very closely. So we're always in constant communication with our pharmacy to gauge how many people are showing up. Do we need to slow down on the doses? Do we need to pick it up because there's a delay? So they're always in constant communication. If there were doses that might be left over, like overnight from State Farm, we take those to one of the other pods. And if the pods have them left over at the end of the day, we take it over to State Farm. As that transitions, we won't have that buffer unless we go back to a 24/7, but they're constantly monitoring.
And can you lay out quickly the logistics of this site? How many you plan to do, kind of how it will work per day, that kind of thing?
So we're planning on doing roughly what we did at Phoenix Municipal Stadium, so about 4,000 a day. You'll see for the next 2 days, it's a little bit less than that as we get our feet under us at the new site, but ASU does such a fantastic job. So it's about 4,000 a day. We're operating from 7 a.m. to 5 p.m. This is a walk-through indoor site, so you park in the parking lot. They do have assistance if you need assistance getting up to the building, but you register inside. You go to one of the vaccination areas. They're a little bit bigger, which is kind of nice. And then you spend your 15 to 30 minutes of recovery or observation in our wellness area in the arena. And then afterwards, you go back to your car and can go about your day. Thank you.
Hi, Dr. Chris. Thanks for taking our questions. So you mentioned supply and demand. I'm wondering if you can expand on that beyond the state sites and sort of say what you're seeing statewide, maybe in counties, and some reasons for why.
Right. So the thing that obviously we have the most insight into is our state vaccination pods. So as we looked today, we still have about 18,000 appointments that are available across all the sites. Some of them have very few. Some of them have a lot. We do have appointments all over the state that are available. So what we would recommend, if there's a site that you are interested in, that you want to go to that doesn't have appointments, try the call center, because we do release appointments each day to the call center. We are hearing from some of our other partners, like pharmacies, that they do have availability for vaccine. And we also know that As we've been allocating to some of our county partners, they haven't been accepting all of the vaccine because they've been vaccinating their general community for longer than even Maricopa and Pima County has. So those are some of the signs that we're seeing. I think the biggest indicator for us was, we would have 110,000 appointments go in 33 minutes at the beginning of this. And for us over the weekend to still have 18,000 appointments when we started off this morning, that tells us that the supply is starting to meet the demand.
Okay. And sort of going off that, I know the ADHS for a while has had the ability to reallocate doses. Is that happening? Are there counties that have too much or unused or not using it efficiently that is being moved elsewhere? And sort of where is that happening?
So our counties have gotten really great at utilizing the doses that they're getting. They've been working with their community providers to get the doses out. So they know, even as we're putting the allocations together, like, hey, we only need this many doses for what we have planned, then we will reallocate it to Maricopa County and Pima County or other counties if we know that they have special projects and may need more doses that are available, then they would be allocated. So we've been reallocating it around the state, but we haven't had to go in and take doses lately to redistribute because people weren't using it efficiently. They're using it very
Thanks so much.
efficiently. Yeah.
Hi, Dr. Chris. This is Daniela Zavala with Univision. Have you seen a decline of people that received their second dose, it's their first dose, but they're not coming back for the second? And what would you say to those people who are fearing the side effects? Because either they had some at the first dose or because they're hearing from other people that are getting those side effects in the second dose?
That's a great question. I don't know that we've seen a decline in the people who are getting their second doses, but we do know that we have had people who haven't shown up. What we would recommend is, for the Pfizer and Moderna, you are not fully protected until you get that second dose. To have side effects like headache, flu-like symptoms, fatigue, muscle aches, fever, a day or two after you get the vaccine, that's completely normal. That indicates that your immune system is doing exactly what it should. And so we would encourage them, you can take medications to help with the side effects, depending on your medical conditions, but ibuprofen or Tylenol after you get the vaccine will help reduce some of those symptoms, and they should go away after a day or two.
Thank you.
Hello, Dr. Chris. This is Griselda with KTAR. Can you talk about the decision to make this a walk-through site instead of a drive-through site?
Yes. So, as we've been trying to find, our goal was to find a suitable indoor location where we could administer the same capacity for every single site that we had that was outdoors. So Chandler Gilbert went to Dexcom, which was very fortunate that they were allowing us to do a drive-through vaccination site. But as you move indoors, having the drive-through is less of a potential just because you are indoors. And so knowing that the heat was going to have a huge impact on the safety of our patients, our staff, and volunteers, that's one of the things that we really prioritized. But we also knew the technology doesn't work as well when it's outside. We had to learn to figure out how to cycle through iPads to keep the technology up because that's what runs our sites so efficiently. So having people walk in, we're in a much different situation than we were back in December and January. Our percent positivity rates are lower. We're not dealing with the same vulnerable population that we were. And so really the safety was the main priority for moving it inside to an indoor site. Mm-hmm. This site, though, actually, the team has done such a phenomenal job, and ASU is so great. They believe that they can double the capacity if we needed to here indoors. And so that's another really good thing. As we continue to get more vaccine, we're just building more and more capacity around the state.
And do you feel comfortable in terms of the percent of high-risk populations that have already gotten the vaccine?
Yeah, so we have seen a significant percentage of our high-risk and vulnerable populations receive the vaccine. So that was encouraging. And we were monitoring both the uptake in our 1A and 1B population, as well as those over the age groups as we've been moving through, and increasing eligibility in Arizona. So that was very, very promising. And hopefully that will play a large role in reducing hospitalizations and deaths due to COVID-19.
Mm-hmm. And any new information you can tell us in terms of how long these mass vaccination sites will be operating?
So, as we continue to plan out every day that we administer first doses, we know we're signing up for at least 3 weeks out because, we want to make sure people get those second doses. So we're continuing to monitor based on demand because if we have no demand, it's not going to make sense to staff and run these major sites. So we'll be watching it through May and hopefully wrapping up by the end of June. But that could change based on demand, based on vaccine supply. And so we continue to monitor on a daily and weekly basis.
And just one last question. In terms of the Johnson & Johnson vaccine, you've talked about it already that we're going to have less doses coming in. Any updates on that? Are we still, forecasted to get less doses for the next few weeks?
So we are anticipating getting less doses than we did last week. Last week, we got a very large number of doses. This week, we know that it's significantly reduced. We kind of take that as our baseline. But our federal partners did give us fair warning that because this was just coming off the manufacturing line, that there would be ebbs and flows of the vaccine supply. So, we here at the state sites are working with the Pfizer vaccine, which has had a very steady supply coming through.
Thank you.
You're welcome.
Hello, Dr. Chris. I'm Andrew Hernandez with 12 News. The weekly case average has gone up for the last 3 weeks. Should the state be thinking of some sort of intervention?
So we're monitoring the case counts. Some of that increased case counts was actually due to reported cases that hadn't been identified because we didn't have all of the testing information. So, and they reported a large number of cases that then were able to be confirmed. So we are seeing increased cases due to new labs being brought on and instances like that. The other thing, though, that we're really monitoring is our hospitalizations and our deaths. Because we may see cases go up, but if the same impact to our healthcare systems and deaths does not occur, we're going to continue to monitor and stay the course.
Thank you.
You're welcome.
Scientists have seen an uptick in young people, young children getting COVID-19. When trials are done and they roll out the vaccine, how will that look? How will you get it to children? How will you convince the parents to get it? Will you set up mass vaccination sites for that? Because I know we're talking about winding down in May, but probably by the fall is when we'll be doing the school-age children, as well as most likely teenagers around there too. What are the logistics going to look like for that? And, should it be optional for schools, for school-age children to get this vaccine? Or should it be something that's required unless you have a medical or religious reason you're not getting it?
We're working very closely with our county health departments. We anticipate that it may be out late summer, beginning of fall. We're still waiting to see what the results are of the clinical trials that are ongoing right now. By that time, what we would anticipate is that the normal healthcare network, where everybody goes to get their vaccines, whether it's influenza vaccine or a school required vaccine, that should be fully operational. And so you should be able to find it at your primary care provider, pharmacies, just like we do. And of course, we want kids to be seen in their medical home for vaccines. So while there may be some community sites, or we may put on some through the county health departments in partnerships with school districts, we would anticipate that a lot of parents would feel more comfortable taking their kids to their healthcare provider. We will continue to monitor. I don't see us requiring that as one of the school required immunizations with the kids. I mean, we've seen cases in children, but really what we want to do is to protect all of the adults around those kids as well. And so we continue to monitor and make recommendations based on the data that we get. Okay. Okay. Well, thank you, everybody. We really appreciate you joining us today, and we're very excited and so thankful to Arizona State University for this ongoing partnership. So have a great day.